Welcome to MACS presentation number 2. We will review how to set up your MACS patient master spreadsheet. Step 1 involves finding a way to collect all of the acute care surgery patient touches at your hospital. One way to accomplish this is to ask your hospital for a system-generated report with all emergency department admissions from the previous 24 hours, including name, medical record number, chief complaint, clinical impression, admit department, and admit service. This will cast a large net that can be further sorted for patients meeting MACS criteria. You should also review the service and census lists. Later, you can go back and use your OR log as a cross-reference to find any surgical patients who had not previously been identified from the ER or service lists. For example, you may find outpatient surgical cases, such as an appendectomy patient who was admitted, had surgery, and discharged all on the same day. The OR log can be reviewed in Step 1, or it can be reviewed at a later step, such as with monthly data cleaning. If your hospital uses Epic, you can call your hospital's IT department and request assistance from the Quality Division with building a MyChart Clarity report. You will want a report that collects all patients admitted to your acute care surgery services, all surgery consult patients seen, and all OR cases. Step number 2, create a MACS master spreadsheet. Here is an example of a spreadsheet with MACS case number, name, medical record number, CSN or encounter number, date presented to ED, time presented to ED, pending follow-up and comments. Columns can be customized to what your center needs to facilitate the work, but name, MRN, and MACS case number should be always included on the list. Next, add the touch patients to the MACS master list. Notice that we have placed a filter over the name column. This will allow you to easily find out if your patient has been abstracted into the MACS database previously, which is a question within the survey. Step number 3. You will go back through each touch patient and determine if they meet MACS criteria. Touch patients are sorted to exclude patients who do not meet MACS criteria. MACS criteria can be found on the MTQIP website at mtquip.org/resources/MACS. as previously reviewed in video number 1. Step number 4. Patients that you have identified as meeting MACS criteria are now abstracted into the Qualtrics data portal. Refer to the data dictionary for the definition for each variable. A complete demonstration of this will be provided in orientation video number 3. Step number 5 involves data cleaning. You will periodically export your data in Qualtrics to an Excel spreadsheet and review it for errors. You'll review the data for missing or skipped MACS numbers, birth dates listed as the current year, or missing height and weight, just as an example. We will have a more robust review of data cleaning in a future training video. This concludes the MACS Master Spreadsheet training. Thank you for your time.